In the 1940s, as the Washington Township area grew, so did the concern for local access to health care. The closest medical facilities were 20 miles away, separated by 2-lane roads. The biggest concerns were for emergency medicine and maternity services. The need for a local hospital became evident in 1946, when the Silva Maternity Home in Niles, which had cared for expectant mothers in the community for 20 years, closed its doors.
Some older doctors up in Oakland, where I was a resident at Highland, Alameda County, they said, "Tom, you ought to go down to Centerville. It's going to explode down there with people." The babies were coming from everywhere, so it was a great experience.
The first public meeting regarding the hospital initiative took place in January of 1948 at a meeting of the Washington Township Business and Professional Women's Club in the cafeteria of Washington Union High School. At that time, a 50-bed hospital was proposed, with the hope that 2/3 of the cost would come through state and federal funding. After a June election, the Washington Township Hospital District was formed. The first board members were Manuel F. Silva, Alan Walton, Fred Melhaz, A.E. Alameda, and Lester S. Whitaker, who was elected president. When the government funds failed to materialize, the community took matters into its own hands. On November 4, 1952, Washington Township voters approved the sale of $1.25 million in bonds to finance the project. Soon, a 10-acre cauliflower field would be purchased from the Stivers family as the future home of the hospital. The location was on Santos Road, which later became Maury Avenue, and the hospital broke ground in March of 1955. Shortly thereafter, it became clear that a 50-bed hospital would not meet the needs of the surging population, and in 1956, the project was expanded to a 150-bed hospital. On November 24, 1958, the hospital opened its doors. Board members and a group of local doctors worked countless hours with help from the community to plan and build our hospital. These physicians became the hospital's first medical staff. Doctors Conrad E. Anderson, Merle Bueller, the first chief of staff, Lyle H. Bueller, Robert B. Fisher, E. C. Graw, E. M. Grimmer, Frank H. McMahon, John O'Connor, and Guy J. Romito.
I think the thing that made Washington a special place were the physicians that were here at the time when the hospital started. I think they were all a very conscientious and a very well-trained group, and were always available and treated their patients well. It was a good atmosphere to practice medicine.
It was started by the people who were farming and running businesses and were going to the churches and all that. They would talk about it. It wouldn't have happened without them.
From the very beginning, it wasn't just a hospital building that defined us. It was the dedicated men and women committed to the facility who made us a success. In fact, in 1955, 3 years before we opened our doors to patients, the Washington Hospital Service League was formed, holding their first meeting at the courthouse in Fremont. Josephine Walton was the first president, and along with Beth Grimmer and Pauline Alameda, worked to organize more than 100 volunteers who were dedicated to the success of their new community hospital. Their mission was simple: make a difference by helping others, and provide funds and volunteer support for the new district hospital. One of their first projects was the opening of a second-hand shop in Irvington called the Cheery Budget Shop.
The Cheery Budget Shop had all leftovers from people. Even the stores brought us things, and we had a lot of customers. And by the time the hospital opened, I think we had realized $13,000.
They took you on tours, they trained you, they staffed, and not just a few things. It was the lobby, the ER, gift shop. everything. It was a huge job. When people are in the hospital, there's a lot of anxiety. And if I can ease that or make someone smile, make their day, it gives me a lot more back than I'm giving. And that's what's kept me here. I like to be that person that somebody says, oh, I met this nice lady at the hospital and she helped me do something.
Well, I enjoy what I'm doing, and I hope I can continue to do it.
Washington Hospital was built 6 decades ago to serve a community of less than 20,000 people. To show how times have changed, in 1960, this letter from Washington Hospital's first manager, William Waddell, was sent to emergency services and nursing departments.
Effective February 24th, 1960, charges in the emergency room will be as follows. A $3 charge will be made when a patient is seen in the emergency room and non-expendable equipment or instruments are used. This will include tongue depressors and minor expendable equipment. The $3 charge will be used when a patient is seen in the emergency room in a sitting position and is examined for any reason. A $5 charge will be made when dressings and/or sutures are used to close a laceration not to exceed 2 inches and where the emergency room is not tied up in excess of half an hour. There will be a $10 charge for such cases as multiple lacerations and/or injuries where the operating room is used in excess of half an hour. When a patient is examined and is further admitted, there will be no charge for emergency service, but only when the patient falls in the category of the $3 charge as described above.
Today, we provide a full range of advanced, high-quality healthcare services for a population of more than 350,000 residents. From the beginning, we've truly been a community hospital in every sense of the word.
This hospital has always looked at the mission as what can it do for the community. And my experience has been that this is one of the rare hospitals, I mean rare, and I mean from the tip of Northern California to Southern California, where the hospital's mission has always been patient first.
During the past 60 years, we have expanded our facilities and services to meet the increasing demand and changing requirements of our growing community. Our most recent facility is the Morris Hyman Critical Care Pavilion. It is designed specifically to meet the growing emergency and critical care needs of our healthcare district and to expand telemetry, intermediate, and oncology care.
The Critical Care Pavilion is a great example of the community coming together by passing a bond measure for themselves. It's what the community wanted. Washington Hospital said yes and really put that to fruition.
I think the community should really be proud of what Washington Hospital and the healthcare system has done for this community. What is the best way to have healthcare in this community so that people won't be traveling far away? They bring it to the people. We should be happy to be in Fremont because we have this state-of-the-art hospital.
As impressive as our continuing expansion has been, the Washington Hospital healthcare system is much more than buildings and facilities. Through the years, The physicians, staff, and volunteers who work here have always been the key to our ongoing growth and our achievements. Like Washington Hospital itself, our physicians, staff, and volunteers often remain part of our team for decades. That reflects an ongoing commitment to the patients and families we serve.
I love the people, the employees. I like helping them, especially the callers. And if they need someone or they need some help, I like, giving them to whoever they need to talk to, and I love that. I love my job.
The commitment to Washington Hospital and to the community we serve weaves through our employees. Those with direct and indirect patient contact all serve our community.
Happy birthday, Washington Hospital.
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 Congratulations on serving our community for 60 years.
Congratulations on serving our community for 60 years.
Congratulations on 60 years of exemplary service to the community.
Congratulations on serving our community for 60 years.
Happy 60th anniversary to Washington Hospital.
Happy anniversary, Washington Hospital.
Happy anniversary.
Happy anniversary. Happy 60th, Washington Hospital.
Happy 60th, Washington Hospital.
Happy 60th, Washington Hospital.
Happy 60th, Washington Hospital.
Congratulations on serving our community for 60 years.
Wishing Washington Hospital great 60 years and 60th anniversary.
Happy birthday, Washington Hospital.
Congratulations on serving our community for 60 years.
Happy birthday, Washington Hospital. It is an honor to be part of an organization that for 60 years has worked to meet the healthcare needs of our community. Our patient-first ethic is ingrained in our history and will continue to be a part of our future.
60 years may seem like a long time, but to all of us at Washington Hospital, it feels like just the beginning.